Good afternoon, everyone, and welcome to our Way Forward Leader Lunch Break. As Carrie said, we are pleased to welcome Keisha Krumm to our conversation today. Keisha describes herself as a lead organizer. This is a title that has accompanied her at every role that she's had, alongside the given title of executive director. And she has organized and mobilized forces across the country, from Sound Alliance in Puget Sound, Washington, to One LA, to most recently, Common Ground Milwaukee, where she served for 18 years. There, she was dedicated to building justice with and for those who were left behind. She challenged them, and she challenges us to not claim that our charity addresses injustice. She holds a Master's of Divinity and uses this in her work at Greater Cleveland Congregation, where she summons voices and forces of more than 40 churches from different denominations to speak on behalf of their diverse congregations. And her work today is more important than ever. Keisha, thank you for joining us. I turn it over to you.
Great. Thank you, Marianne, and also thank you, Carrie, and thanks to the Rapid Response Fund, which has been a great support of our Color of Health work, really from the beginning when we started in 2020. And Marianne, it's good to meet you, and thank you for the opportunity and the good work that you all are doing to bring these different topics to our community, and really bite-sized pieces where people can get some good lunch and good knowledge. So thank you for the opportunity. So I am Keisha Krumm, the lead organizer and executive director of Greater Cleveland Congregation, and I've been doing this work for about 20 years. It'll be 21 years in October. And it's been a great gift. And I would also say a privilege. That it's a privilege to be able to work with so many different people that are so passionate and committed to real justice and real change, and doing the work that it takes to create the results that we've developed. And behind that work is hundreds of volunteer leaders. So while I get to have the privilege of speaking to you today, the results that we get are really from people like Lee Morskowitz, who's on this call, and other volunteers in Greater Cleveland Congregation. So I'm going to talk to you about our Color of Health initiative, which was started in July of 2020. And so we all remember the moment in March when our state really shut down. As Greater Cleveland Congregation, we had just at the end of February had 1,000-person assembly at Olivet Institutional Baptist Church around our criminal justice work. And just a week later, everything was shut down. And during that time, our leaders reflected, we read, we met together like lots of other organizations, and really thought about how do we in this moment really manifest what it means to be people of faith and people that are committed to being present in where we are as a community, and also bringing creative ideas to think about how we can actually address some of the challenges that we're facing. So 4 of our leaders, 3 of them pastors, 1 lay leader, Reverend Jawanza Colvin at Olivet Institutional Baptist Church, Reverend Ronald Maxwell at Affinity, Reverend Quincy at Lee Road, and Louise McKinney at St. John AME, said, we should actually do something that brings testing to our community. Because as we were all looking at the disparities that were happening around race, and we were seeing that testing was available to people, to the white community more than it was to the Black community. And so then our congregations organized then 17 other African-American congregations throughout the county of Cuyahoga to meet with Terry Allen and ask for testing to be done at those congregations. And so starting in, I think it was July of 2020, we started doing testing at 17 congregations. And there were a number of other congregations that Metro Health was doing testing with as well. And so through that first round, we got about 1,800 people tested. And so the opportunity we had from that was United Healthcare actually reached out to us because they heard about our testing work and said they were looking at a program called Stop COVID. That's a national program that they wanted to do testing. And so we were able to partner with them to bring that testing for 6 weeks in our community. And during the month between Christmas, between Thanksgiving and the December holidays, before the end of the year, and provided testing for about 3,500 people. And about 60% of those people were African American. And what we were, really seeing was that this provided real access for people to be able to test their status. As we were then, thinking about what was next, there was lots of conversation, if you all remember, about vaccines. There was lots of concern because of the prior administration around Operation Warp Speed and what did that mean? And so we then partnered with the Union of Concerned Scientists, and we did an education session to really educate about 100 people that would then lead small groups about the science of the vaccines. So this is what we were doing in January and through January. And so then we had the opportunity to be a pop-up site for testing. I mean, not for testing, for vaccinations. And so Elizabeth Baptist really led with being the location. And what we seen in that moment, it was like right at the beginning of vaccinations. We had it was about 92% of the people that came were African American. And what we had been hearing was that there were people that were on 3 or 4 waiting lists trying to get vaccinated. And so the access that we provided was really significant and important. And so in the first beginning of vaccinations, within 6 weeks, we provided access for 3,000 people to get vaccinated. And a majority of those were African American through several of our congregations. And so a lot of our work has really been about providing access and engaging our medical systems and insurance, like United Healthcare, to organize their resources to bring vaccinations to the community. The second part we started to see as that first wave of people getting vaccinated started to go down, we then have now gone into the neighborhoods. And so what we've been doing, we've done about 4 canvases in the last, I would say, 6 weeks. In Slavic Village, Central, Lee Harvard, we have another one coming up this weekend, or the 26th in Fairfax, where we've been talking with people about vaccinations. Because what we've seen is that now we're at a different group of people that either need it to be really convenient, like coming to their door, or they have hesitation. And so we've been having those kinds of conversations. And our commitment is between now and the end of March is to provide, access for at least 7,000 people to get vaccinated through our congregations. And the other part to that is our congregations have actually created an incentive fund so that when we get pop-up sites available to our congregations, that we would be able to give people a $50, $50, like a beautiful $50 bill for coming to get vaccinated. And that's something that our churches have said they wanted to create that fund to actually incentivize people to be able to do that. And so what I've really appreciated is the commitment of our congregations, but also the creativity to really think about like 2 or 3 steps down the road and, what's coming down the pike, what do we need to do next? And then putting themselves in the position to actually do it. And so that's the fun part. And we've really appreciated the recognition and the support that we've gotten from the Rapid Response Fund in particular, because that's helped us really animate our ideas of providing PPE for people of our congregations to actually host the spaces. So do I have still a couple more minutes before questions?
Yes.
Yeah, there's another piece that a lot of people don't know about. One of the other things we've done is we're starting a business called a collective purchasing alliance, because a lot of our congregations, they were not meeting in person. And so the usage of those facilities, they still had to pay for. They still had to pay for lights and garbage and trash. And so we've been able to actually help reduce trash hauling for several congregations by 60%. We're in the process of now doing a collective purchase around electricity to see if we can get a lower rate on electricity. And that was a key part for us to say, you know, as our congregations are really on the front lines of providing access around COVID-19, whether it's testing or vaccinations, looking at how do we help them reduce some of their cost on the back end so they can continue to do that ministry and that service. And that was another one of the projects we got funded through the Rapid Response Fund that's related to our COVID work. So I'll stop there and see if there's any questions or any reactions or anecdotes from any of our GCC people that might be on the call that I might have missed.
Keisha, thank you so much. We have a few questions that have come in, so we'll start. As you've been out and talking with community members, what were some of those hurdles with access to vaccines and also some of the hesitations that you heard, and how did you work through those for some individuals?
Yeah, so some of the hurdles were the sense, like isolation, that people, a lot of the people we talked to didn't know other people that had been vaccinated. And so a lot of the information that they were getting online, I mean, we heard things like people saying that the vaccination is putting a chip in your body, that it's the mark of the beast. If you grew up in church communities, you know what that means, the sign of 666. Or that, you know, so you could say like, oh, that sounds so irrational, but they had really rational thoughts. And if you didn't know anyone that had been vaccinated and seeing how their experience was, we heard people talk about the concerns about the side effects and not wanting to miss work. And, you know, I think the interesting thing, like we had people say like, we were vaccinated. This was my experience. And from those conversations, we actually had people willing to go get vaccinated. And so, so that was something we seen, that we were able to have a conversation with a person, not judging them, wanting to understand their thinking, talk about our experience, say, it's going to be right here at the church on Thursday. You know, come over, we'll take your name, we'll follow up with you, we will remind you to make sure you get there. And so we've seen that really happen. The other was that, you know, people just had a lot of questions. They were sick. A woman that, you know, was on blood thinners, or another woman that was had breast cancer, and their doctors had said they should get vaccinated, but they still had a lot of questions. And one of our volunteers just so happened to be she's not a registered nurse, she's a nurse practitioner. And so she was actually able to have this really like thoughtful conversation about the questions they had. And they still chose not to get vaccinated, but I could tell they moved from like, nope, I'm not gonna get vaccinated, to like, okay, I'm gonna think about that. And that was a big sense. And so our lesson was that I think if we can have conversations with people about what they're thinking and then providing that easy access, we're gonna get those people that are willing to move and actually get vaccinated.
Kind of along similar lines, did you run into conversations where there was fear of medical testing or distrust of the medical system due to kind of historical situations with BIPOC communities in the medical community? And how did you have to kind of address those concerns?
Yeah, I mean, like, so we had, there was a person that, you know, was saying like, this hasn't been tested that long. And I remember asking the question, I said, well, what's your number of like, how many people need to be tested on? And they were like, oh, I hadn't thought about that. Cause I was like, there's like millions of people that have now been vaccinated. So, I think those questions about, it wasn't so much about the history, because this was a younger group. So these were people younger than 40. And so their kind of thoughts were really about this chip and this apocalyptic vision that was really interesting. And I thought, they didn't talk about like the lack of trust, but I think because that lingers in their mind and their grandparents' experience, it all filters in to make it seem like a rational idea that there's something up, with this vaccine, because of all the history that I heard my grandmother or my mother talk about. And so this makes it really rational to me that no, I'm not going to try this.
So as you look ahead, for how long do you see this work continuing? And are you seeing more of that openness to get vaccinated? And kind of also, are you seeing kind of an incidence of COVID as churches and congregations come back together?
So a lot of our congregations are figuring out what it means to be back together, and are going to start that in August, September. There's been discussions just about, as the variants keep happening and we continue to see the lower numbers of African Americans that are getting vaccinated as compared to white, that this concern that in the fall, we're going to see another spike and another round of unfortunately, deaths or really severe sicknesses. And so part of what we've been sorting through is thinking about mobile vaccinations, that we would connect with our canvassing to actually have a vaccinator with us. So when we find that person that wants to be vaccinated, we could put the shot in their arm, right there, as well as continuing the pop-up sites. And then, I think the other part for us is that we're committed, at least through March of next year, to continue on this vigilance about everybody we talk to. Are you vaccinated? There's lots of places in our community right now that people can go, making sure they have that information and making sure that there are people in those conversations that are committed to following up with them to see where they go. Because we know that everybody that we at least bring access to the vaccine, we're helping to save lives. And that's really important. And that's why our congregations have created an incentive fund to say, maybe it'll help to get people over if they could come get a shot and get a $50 bill. And then they come back and get their second one and they get another one. So there's a commitment to keep trying for our folks.
So what would you say has been the greatest impact of the pandemic on the populations that you serve?
I mean, there's this real sense of, the isolation was really hard for people, of being disconnected from their families and their communities. We did a town hall meeting with about 300 folks, and we talked about the impact on the Black community as it relates to congregations, as it relates to businesses. And we know that there are businesses that have closed and haven't opened again. And that's a real concern about all of those pieces of infrastructure that were a part of these different communities, in some ways have been disrupted because of the impact of the pandemic. And there's just been, all of our congregations have had increased people coming for food distributions during this time, and those numbers continue to stay pretty stable. And so that's a key piece of just trying to be present to where people are, and then really us thinking about what's next, and really engaging families, and then doing the advocating that it's going to take to create the resources and the structures that are going to support them to be their best selves.
Keisha, so much of the work that Greater Cleveland Congregations does is very based in collaborations. And as you think about what has made those collaborations successful, what are some of those best practices or takeaways that you can share to help others figure out how to collaborate a little better?
Yeah, I mean, one of the best practices for us as GCC, we believe you should build relationships before you need them. And so there's a lot of emphasis on meeting with key people in our community, getting to know them, finding common interests, so that when this pandemic hit, we were positioned really well to not just go to somebody for a transaction, but really go and talk about a conversation because they knew us, and that we can then talk about an idea. So I would say really build relationships before you feel like you have to need them. The second is, I think, to have a real finger on the pulse of the people that you're serving and engaging. And so for us, that is what really drives the decisions that we make. And so we decided to get into COVID because we were hearing that from our congregations. And we thought we had an idea that would have some impact and create access and save lives. And so we took a risk, right? Like, when we got our first funding from the Rapid Response Fund, we were just ecstatic because we were like, oh my God, this is like a crazy idea. Nobody was doing it. And so it was just this thrill of like, we had this bold idea that wasn't really tested, but there was, this group of people that were willing to take a risk on that. And it really did pay off. And so I would say be bold and don't limit your imagination and leverage the relationships that you build.
So what have you learned from the outreach that you've done through both testing and the canvassing and vaccine access that's going to help inform future initiatives for Greater Cleveland congregations?
Yeah, so one of the things is we've been out in the neighborhoods talking with people, literally knocking on their doors and having 15 to 20-minute conversations. This real question about civic engagement in our city, and I know there's lots of people that have talked about the fact that Cleveland's voter turnout has actually gone down, not up. And as we've been out having conversations, we get a real sense of why that is, that, people feel like they are voting and nothing's really changing. The streets are not getting clean. The businesses that are coming in are not, picking up the trash, or they're selling rotten food, or they can't get their streets plowed, or the violence in the community. And so part of it for us was that we have been, glad that we've been able to like really provide a space and impact. But also, if we're going to be who GCC was built to be, addressing this question around civic participation, and that our experience in our democracy becomes real, like not just about voting, but it becomes about dreaming, imagining, and making things visually happen in our community, so that when you walk out, you know that the dollars I'm spending for my taxes are being used in a public good for all of us, and that I see that my right to vote really does matter and is really going to make a difference. And so we are in conversations about, as we go into this new opportunity, Cleveland's going to have a new mayor. And our leaders are interested in being in relationship with that mayor and dreaming and thinking about the things that we're hearing in these conversations, and how does that really shape what kinds of initiatives happen in our communities, along with all the other good things that are happening as well.
So let's look ahead. What's next and on the horizon for Greater Cleveland congregations, and what's your vision for its future?
Yeah, so we have a lot of things going on. I talked about our Collective Purchasing Alliance. Our criminal justice team is in the process now of just did a round of what we call house meetings with almost 200 people to figure out what our next focus is going to be on criminal justice. I talked about our voter engagement work, that we're actually looking at engaging in communities. We're doing some really fun neighborhood organizing in Lee Harvard, and really identifying projects and ideas that the neighbors have about what they want to see happen in this community. And I think the other part for us is, how do we continue to grow and expand not only in Cleveland, but then in Cuyahoga County. We know that, the next 4 years are really important, that our people feel that our democracy is working. And so we're committed to making democracy work and showing that it's real. It's not just about voting, but it is about all of those other things. And so we're excited about the 2020s. We think we kicked it off really well during the pandemic, and we are looking forward to continuing to move around issues of democracy, of criminal justice, around education and economic justice as well.
And what can those of us who are here on the call, but those also of us in the community, do to help you reach your vision?
Yeah. So there's a couple things. I mean, one, we're a member organization, and so if you have a congregation or a nonprofit, a school, a labor union, a business that wants to be a part of GCC, you can join as a member organization. And we do meetings and trainings to really train people like how to operate in our democracy to make things happen. You could also donate. That's a very easy thing. You could go to our website and you can donate to Greater Cleveland Congregation, for the great work that we're doing. The other, if you said, like, I really want to help with the color of health, this incentive initiative that we've started, if you wanted to, donate $50, $100 to help, with that, so that when we do have people come, we could actually give them an incentive. That's also something you can email. If you go on our website, you can email us that, and we will help, give you directions about how to do it.
And we will be sure to send your website in our follow-up email so everyone can check out the amazing work and follow up with you afterwards. So Keisha, thank you so much. And thank you for all the work that you and the congregations have done in our community over this past year. It has been absolutely needed. And we are thankful for all of that.
Yeah, and just one last thing, you could also like us and follow us on Facebook and Twitter. And if you're hip enough to have Instagram, you're on Instagram as well. I'm learning that that's a different generation of people. And so we're trying to increase our social media footprint. And so go like us and follow us. We love that.
Great. That's very easy way to show support. So Keisha, thank you. In a very short time here in Cleveland, you have more than hit the ground running and just forged forward. So thank you for all that you're doing, particularly in the pandemic. Really, really challenging times.